in those communities. What you can also see, and this is why the data is so important, is what the life expectancy is. By the way, I know that there are a number of additional communities in the San Gabriel Valley. This is not meant to be comprehensive. Please know that you can go into the report itself and pull up data for your neighborhood. But you can actually see, like in unincorporated Altadena, the median income there for most residents is around $109,000, but for African Americans, it's around $91,000, right? Which is actually not too bad, because to be able to do well in LA County, you need to have at least roughly $84,000 a year for a family of four to be able to be stable. And certainly if you had more, you can do better. But you can essentially see what the median income is for a lot of folks. So relative to places like Inglewood and Lenox and other communities, and some places where the median income is around $22,000 for African Americans, many of these communities are actually doing a whole lot better than some other neighborhoods in and around the county as well. Doesn't mean it's the best, doesn't mean it's perfect, but it is slightly better. Also, you can see the unemployment rates are below, they are higher in some cases than the total unemployment average for those neighborhoods, are higher in most cases for African Americans than all those other places. And you can also see what educational attainment looks like as well. Somewhat on par in West Covina, but for African Americans, higher than the average population as well. So every community has a different set of factors in those neighborhoods. So it's important for you all for us to note what the data looks like for folk in our specific communities. All right, next slide. So last year's report came up with some recommendations. Let's create some one-stop shops that are centered for Black health equity. Let's invest in community-based organizations and all move our dollars from systems of harm into community-driven solutions that address education and housing and employment and the like. And let's create affordable housing communities. These are three of the primary recommendations that came out of last year's report. We get to put forward new recommendations in this upcoming report, and that's what you're here to help us figure out today, okay? We want your help to think about and design what those next set of recommendations are going to be. So you can see all these beautiful data points and these boards around the room. I'm going to tell you briefly about what the next report looks like, and then I'm going to get off the mic, okay? So that way we can get to the panel and have really, really good conversation tonight. So note these recommendations. They're in the report. We invite you all to help us think boldly, think outside the box, think about what's possible, and push the envelope on what the county can do. Next slide. So, looking ahead for the year 2 report. This is really important. We'll move on to the next slide. So, you know, the board motion that declared public racism as a matter of public health was passed in 2020, actually, ignore the 2020. Since then, the county has made significant strides. We've launched ARTI, as you're aware. We've adopted a countywide racial equity strategic plan. We've embedded equity in the $2 billion that's been distributed through the American Rescue Plan. The county has adopted the Poverty Alleviation Initiative. I literally had an incredible meeting today. We're talking about equity and infrastructure. For those of you who live in Altadena, unincorporated Altadena, Public Works pretty much serves your community. They are restructuring their whole department with a focus on equity. I'm super excited about what that looks like. And the like, we're addressing Black people experiencing homelessness. There have been new departments of economic opportunity, youth development, justice care and opportunity with our Care First initiative and alternatives to incarceration, and an increasing focus on LGBTQ+, transgender diverse and intersex rights, as well as prevention and promotion coordination. There's a lot of work that's being done right now in LA County, and I'm super proud that we have had a hand in helping to move some of that work along. Next slide. But, as I said earlier, there's been regression. You can call it the boomerang effect, you can call it counter change, you can call it racism roaring its ugly head again. You can just say, hey, we're back in another cycle. After Reconstruction, occurred in the 1860s, right? And the troops left the South. What happened? They went all the way back, and then Jim Crow came in, the Black Codes came in, right? All these things started happening when the troops left. Had they stayed a little bit longer, who knows? Maybe the entire, trajectory of our society would have been altered. But we can't go back in history. If I had a time machine. This has shown up in the form of Supreme Court decisions that are restricting rights and opportunities. We've seen all kinds of decisions that have had an impact on people's lives. Book bans, anti-LGBTQ plus, especially trans bills, the ending of DEI initiatives, and much of it is a pushback and a retreat from equity. So we're going to be talking about this in this upcoming report. We want to be realistic and pragmatic and show the community like what's really going on and not sugarcoat any of this, right? Because if we're going to make a real policy difference, then we got to actually appraise what's happening. So next slide, we're in what we're calling an era of regression. And it happens. But evil wins when good people seek to do nothing, right? When we stop doing things, that's when bad things win. So we're not going to let that happen. RD in the county is doubling down. We're pushing back against this era of regression, and we're making sure that here in LA County that we're paying attention to how we can advance our work in light of this era of regression. So we want to hear from you all as well today. Next slide. Some of the ways we're thinking about doing that is by focusing on what it means to address belonging. We've seen a rise in hate crimes. We've seen a rise in, attacks on people on the basis of race or gender or sexual orientation and the like, or religious identity and the like. We've seen people physically attack people and kill them on the basis of their identity. And so we're pushing an agenda that's focusing on addressing issues related to Islamophobia and anti-Semitism and anti-Black hate and anti-Latino sentiment, right? And so we're focusing on these themes of othering and belonging in this year to address racism and social exclusion, to make sure that we all feel included, we all feel like we belong in LA County, and then thinking about the role that county services can play. And so we're also including in this upcoming year's report an analysis of the services that the county's providing to actually address the issues that we've identified. So instead of just being like, yeah, we see that there are housing issues, we're actually showing what the county is doing to address those issues, right? So we can paint the full picture of what's occurring. And we're expanding our focus to 3 new domains. So from health and housing and safety and justice, and the other ones that I talked about, we're focusing on youth and what our youth need. And we've been having a number of youth listening sessions that we're super excited about. We're focusing on the built environment because we know that your space and place shapes your life. And then we're also focusing on civic engagement and the role that political life plays in our communities, as well as additional indicators with those domains. Next slide. So again, themes on being in an era of regression. We have a new research team that we're super proud to work with as well. We're grateful for our research team from last year, but we partner now with LMU and the Center for the Study of LA. Dr. Shea Crowder is the lead researcher there. We're really happy about it. We're still partnering with our friends at Dominguez Hills and other communities. And then we're also still partnering with our colleagues at the Internal Services Department. This year, we expanded it to do an opinion poll. So we're using our opinion data from opinion data that was gathered from the Center for the Study of LA's annual LA opinion report. We're doing increased interviews, focus groups, geospatial analysis, listening sessions. Again, we have these additional domains. And go to the next slide. And we're adding some new components. So yes, we have our bar charts, our maps, our dashboards, images, and infographics, but we're also adding, as I mentioned earlier, that inventory of county services. And we actually want to interview folk. So this year, we want to include the stories of the people we've been talking to and start committing to our civic memory the histories of the lives, along with direct quotes from interviewees, and surveys. We're trying to figure out if we can do some like AR and VR stuff. I'll keep you posted. I don't know if it's going to be possible. Tolu is like, that's a heavy lift, Dr. Scores, and we'll figure it out. But we do want to make it so that hopefully one day when you walk down the street, you can break open your phone, you look at a specific center or location, and it'll tell you the history of that neighborhood. Right? So that's where we're like going. See, I told you they like it. See, I told you. I like the idea too. So that's where we want to go, right? We want to get to the place where we're able to actually tell the story, connect to technology, build up the civic memory, and remember the history of the people that have been here in LA County and do that for so many communities. There's also a chance that we can, take this model and expand it to other communities. Do the state of Latina, Latinx communities report, the state of AAPI communities, the state of fill in the blank, whatever it might be. Our goal is to help tell these stories so that the county can be responsive to their needs. Now, before we get into our panel, And I just want to, again, thank our panelists for joining us today. I'm going to turn it over to an incredible MC who's going to lead that work. I want to pause for a second, see if there are any questions. Take questions, because then the panelists are going to be able to take it over from there, and then we're going to move into a community dialogue and event. I see some folk are ready to raise their hands right away. So let me go ahead and take questions right now. Yes, go for it. Tell us your name. Yes, hi, Pilar. So the domains were selected based upon the original board motion. The Board of Supervisors said they wanted to, thank you so much. The Board of Supervisors said that they wanted to see research in the areas of the economy and safety and justice. So if you look at the original motion that created Artie, we mirrored those domains. That's how they were selected. We didn't stop there though. So they said, use this as a starting place, but now we're expanding. And it's largely a result, the ones that we are now selecting have been a result of the listening sessions and what we've been hearing from community. So if you, for example, have some example of you have a strong desire to include some domains that maybe not be listed here, that's what we want to know. You said which ones, efforts? AIM, African American Infant Mortality Initiative. It is actually in there in our physical health area. We actually did include AIM efforts in there. It's not as emphasized as we want it to be, because it's also in our racial equity strategic plan. So the racial equity strategic plan the board adopted in last July has 5 primary countywide racial equity goals, of which one of them is to reduce and to eliminate infant mortality. And that actually focuses almost predominantly on the work that's taking place with AIM, but also other communities as well. So we've elevated it in multiple ways throughout the county, through multiple, docs. So I wouldn't look at this, just so we're all on the same page, do not look at this as the end all be all for the equity work that's taking place in the county. There's so much more that's being done, but that's a really great question, and thank you for asking. Yes, tell us your name. Yep. That's a great, tell us your name again, I'm sorry. Gary, thanks so much, Gary. Great point. One of the things that we've been noting is that there's a rise in, again, as I mentioned earlier, an aging population that's experiencing homelessness. And there is data by age, right? So it is by race and by aging. You can do some of the sorting in there. But I don't think you're right. I don't think we did like a deep call out by like age or gender, but we did do some data analysis. Maybe Dr. Woodall, would you like to respond briefly to how we incorporated age?
Yes. So the first time around, we did it but this next time around, we are and so we will be looking at different issues that different subgroups within the Black community are experiencing. So for example, we're going to be looking at homelessness again this year, but we're also going to be looking at the different groups within the Black community who are at elevated risk for homelessness. So we cover it there. In our health section this year, we're looking at disability. We know that Black and African American people in the county have higher rates of disability. We're also looking at youth and foster youth in the county. We also know that Black elders are more likely than their counterparts to be caretakers for their grandchildren. And so we definitely are looking at older people this year. So I just wanted you to be rest assured that we are looking at those issues.
Oh, yeah. 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 Gary, I invite you to put that on these notes as well for us on the walls so we can capture that. I really appreciate that's the reason why that's why we come, because we want to hear this, right? And think about like what can we include and incorporate. So thank you so much for lifting that up. And by the way, I think we're all still trying to figure out AI. I don't know about y'all. It's a whole thing. I don't know if y'all saw the news about Sam Altman and the SEC investigating him now, but hey. By the way, I love AI. I don't know about y'all. I mean, I know, it is what it is. But if you do get a chance to check it out and you pop on a ChatGPT or use Cast Magic or Otter AI or Zoom, I'm telling you, the White House just had a policy session yesterday. I couldn't attend it, but they had a policy session in partnership with the Congress. I think it was in partnership with the Congressional Black Caucus to talk about how AI can either accelerate equity or exacerbate it. And if we don't get involved in that conversation, we are going to get left behind. I'm telling you right now, we are going to get, because it is a tool. We got to talk about how it's going to affect education. Yep. I'm a faculty member at UCLA, and I teach in the School of Public Health. And I'm actually now starting to figure out how to incorporate it in my class, because students are using it whether we want them to use it or not, right? They're going to use it. But if we don't make sure that folk of color in our communities or people who are typically historically excluded from these industries get access to this, let me tell you something. AI lets you take a 15-page document and drill that thing down into 5 paragraphs or 5 sentences. So if any of y'all ever have to do some editing, you better get yourself ChatGPT. I'm telling you right now. Next hand. Sorry, not slide. Next hand. Questions? Yes, ma'am.
When you showed that the positives, that there was more Black people having health insurance, I'm glad you explained that, because that was a big question for me with a background in health care. A lot of people that looked like me came in the hospitals with no insurance, or they had Medi-Cal, which was a problem, and they did not receive care because they did not want to spend that kind of money on Medi-Cal patients. So what I would like to see is the breakdown of how many Blacks really applied for Obamacare and are really using Obamacare, because that was a nice percentage, 90%. But with my experience, I really would like to know how many.
That's a great utilization. So not just enrollment and access, but also utilization. Thank you for lifting that up. I think if we have access to the data, we can try and figure that out. You know, one of the challenges of being at the county level is that we're not also at the federal level, right? So the federal government often has access to that type of data. I just got off the phone yesterday with the VA Health Administration, and we're I was looking at some of their data and I was like, oh my God, we could really use that data, right? Because they're able to access data because it gets reported up to them from across the country that sometimes we're not able to because of laws that prevent us from sharing that type of data. But it's a really good point, because I think we can actually try and figure out, like, where can we get this data from? How can we use it in aggregate? How can we figure out what utilization looks like? Because if it is, even if you are enrolled and you're underutilizing, that can be a factor that's contributing to negative health outcomes. Really, really good point. Tell us your name. Irma. Thank you, Irma. Appreciate it. Other questions? Yes.
I just first want to definitely, Ms. Irma's point is well taken. As a member of the community who hearing of people who have the insurance, they were enrolled, but they couldn't even afford the monthly payments for the insurance. So it, including the California Obamacare. My other question is, my question though is, I'm trying to say this in a very positive way. When the next report comes out, I think sometimes, and I'm not saying this report, sometimes when there are reports pertaining to African Americans, Blacks, all the things are added into it, and then it comes defocused on African American and Blacks. So I just want to make sure that the commitment is, even if you're reporting on different subjects, that those are pertaining to African Americans and Blacks in this particular report that's supposed to be on the state of Black Los Angeles, if I'm making myself
I
clear.
hear exactly what you're saying. Thank you. Tell us your name.
Patricia.
Patricia. Thank you, Patricia. Patricia Irma Gary. I never remember names. Pilar. Oh, wow. Okay, I did it. All right. I'm telling you, I don't remember. I'm telling you, it's something about this space. Yes, this is a report for the state of Black LA County. It focuses specifically on African Americans. It focuses on outcomes facing African Americans. In order to understand what those outcomes are for African Americans, it's important to compare them to other populations here locally. And that's one of the reasons why you see other populations incorporated in there, right? Because we won't be able to say 3 or 4 times more likely or 5 times more likely, but it does focus specifically on African Americans, hence the data that is highlighted. So thank you for elevating that. And it's one of the reasons why I've mentioned that other communities have said, we want our own report too, right? And guess what? I think that's perfectly fine. We can acknowledge both our commonalities and we can acknowledge our differences and respect the fact that our communities are going to have different needs. One of the conversations, so we also work on Latinos experiencing homelessness in LA County and addressing the rise in Latinos experiencing homelessness. I have another listening session next Wednesday or Thursday of next week. One of the things that I've been learning through those listening sessions is that the term Latino is not one that everyone from quote unquote the Latino community identifies with. For some people, it's a political designation. It's not an ethnicity. If you're from Guatemala, you might actually feel very different than somebody who's from Mexico, will likely feel very different than someone who is from El Salvador. Even northern Mexicans here in Los Angeles feel very different from the way southern Mexicans feel too. So if we don't take a step back and get outside of our monoliths, get outside of our assumptions about people and their identities, and actually pay attention to difference with a recognition and appreciation for our commonalities, we won't be able to fully address the needs that populations have, right? We won't be able to target those needs we're using sort of a targeted universe. We won't be able to have these universal goals, but specific strategies, and recognize that there is enough to go around. There is enough for us to say, and we need a report on Latinos experiencing homelessness, and we need a report on Black people experiencing homelessness, because the solutions are going to be different for those communities based upon their conditions. And so and that's what equity is all about. Recognize that people have different backgrounds, they're starting from different places, and they have different needs. One of the things that equity is also about is paying attention to, those needs and those conditions that people have. Folk in South LA may need more parks, but guess what? In Palos Verdes, people's homes are falling off a cliff. Okay? We got to take care of that too. Just because they live in Palos Verdes doesn't mean they don't deserve support. Doesn't mean we should let the homes fall off cliffs, right? Or a whole chapel or a church fall down and slide down. Similarly, in Antelope Valley, as I mentioned, it's a transportation desert. And there's a need for, infant mortality support. A lot of African Americans, Antelope Valley used to be a sundown. There used to be sundown towns up there. Similarly, used to be sundown towns in Glendale. Also, I was told the other day, somebody said Redondo Beach, but I don't know if that's true, so I have to look that one up. Somebody was like, yeah, here in my community too. I was like, well, maybe. I don't know. I have to check. I can't just go around saying stuff, They're going to hold me accountable. So the point that I'm making is that, that we got to pay attention to differences and pay attention to where people are starting from. And equity is not about taking from me to give to you. Equity is about making sure that you have your needs met and my needs are being met as well, and that we balance those resources so that ultimately all of us can thrive. One additional hands, and I see Dr. Wudola raise her hand as well. Did you want to add a comment?
And I can assure you that at every stage of this process, this report goes through Black hands, right? The lead researcher on this team is me, right? The sister at LMU, who's the researcher there, is a Black woman. This guy gets to look at it next, and then the Black CEO looks at it next, and then it goes to the board where we have the SD2 board member who keeps us accountable. So at every level of this process, Black folks are the ones who are looking at this, in charge of this, making the decisions about this, and keeping everybody honest and keeping everybody accountable here. So I wanted to make sure you knew that. You're welcome.
Thank you for sharing that. And the Congressional Legislative Black Caucus calls me, and they're like, you better tell us what's going on in this report too. So I just want y'all to know, even at the state level. Yes, in the back. Tell us your name.
My name is Alan Shea, and I find your presentation interesting. I'm a political scientist and certainly definitely engaged in Pasadena community. One of the things I didn't hear is really the analysis of the historic journey compared to the issues of the day. And in listening to some of your analysis, you went from issues that were intentional or human versus weather and climate and things of that nature. When you said help was needed, like when you used the folks whose houses were sliding off the cliff. I think if we're going to try and be specific, we need good, clear analysis and our history to help pull us up. Because if we don't know our history, we're not applying it, we're going to be all over the map. And that would be my encouragement from what I've studied and what I look in my community here. And I would certainly say for us to move forward as Black people to try and assess really our state of affairs. In my years of being in business and what I've done with policy, you cannot have an affair if you don't have your history and you don't have your plan.
Oh, Alan, well, touche. Well said. If you don't know where you've come from, you don't know where you're going, right? This is Principal Sankofa. Thank you for sharing that. I really appreciate that. Other thoughts? Yes, in the back.
I work with the AIM
Take
project
them on.
as a volunteer in the San Gabriel Valley.
Yes. You said the AIM project?
AIM, the African
Can you just briefly
American-
explain that for the benefit of the audience? I'm
Okay.
sorry.
So what we do is, so we work with African American infant mortality. It's like an initiative. And the great thing about we work in community with moms and doulas and midwives. And I didn't know anything about a midwife or a doula 20-something years ago when I was birthing. There's been a lot of advancements that now women can use their health insurance, their Medicare, to be able to get a doula. But for us, just like medical doctors, it's like 2% or less than that in California. We have maybe 2 birthing centers on this side of California that Black women can access. So there's quite a few challenges, although there's been growth in it. One of the biggest challenges is that our moms are still suffering in silence. Whether there's a diverse, we know this is an international thing coming from the White House about through Vice President Kamala. She's kind of raised a lot of awareness saying Black women are 4 times more likely to die in childbirth. No matter what category you're in, what income you're in, none of us are immune from being able to fall into these situations. We directly I work with the community outreach section of it, so we hear directly from moms. So my plea with this is that please go directly to our moms, to our doulas, to our midwives, have those focus groups. Our moms are driving our initiative by telling us exactly what their needs are. And when you talk about not just childbirth, we have moms who cannot nurse properly because they don't have enough food. And we're trying to take the stress off of them, which is one of our main reasons as to why racism and stress is what causes maternal health issues. Yeah. So we are doing this initiative for our children, for our young girls, for our moms. So it's not just our issue, it's all of our issues. First 5 LA is one of our collaboration partners, Department of Mental Health. We are seeing that it is a wraparound service issue. Our moms go right into depression, postpartum depression, because they can't find food. They don't have childcare. They don't have enough to meet their needs. They cannot work. And we're telling them, go lactate. Well, they need a lactation specialist. And then the WIC might not have enough of the resources. So this is an initiative for all of us to get involved. And what we're doing is we're trying to educate them, we're giving them resources, but we cannot, once we get into one area, there's another need. Yeah. So I think what you're doing with the report, please invite them to the table and they will tell you exactly what they need.
And Jo and her team, the AIM team was actually a part of our strategic planning process for racial equity in LA County and helped to set the goal for infant mortality. So thank you so much for lifting that up. Folks, we're a little bit over time, and I want to make sure we have time for the panel in our listening session. So I just want to take a moment to extend in my appreciation and my gratitude, even for the conversation we're having today. Again, thank our partners at the YWCA, the center here, and then our caterer as well. But just acknowledge that this work may be up and down, but it's always forward. And we can't lose sight of it, right? We can't lose sight of how challenging and difficult things may be, because if somebody didn't carry that water or fight that fight for us 20, 30, 40, 50, 100 years ago, we would not have made the progress that we've seen today. And so I am not discouraged by what we see happening around the country. I'm actually fired up. and I'm fired up to fight. And I told my team the other day, I was like, yeah, you know, I've been in accounting for a few years, but y'all ain't seen my nonprofit community organizer self just yet. You know, we fought, you know, I don't know if y'all know, y'all had like tenant coalition down